is for the dissection. I'm going to go back to this view real quick. Right where it has this number 3, can everyone see this dark tissue? That's the thyroid, all right? Now, it covers all of these vessels that we're going to be paying attention to, so you're going to remove that and get this, where you have all these vessels laying underneath. So all you're really going to do is just kind of pull it and it'll come out. You'll want to spend some time cleaning up this area so you can clearly see where these vessels run, okay? Another trick that you can do, here you can see that they have the vein going into one arm and the artery going into the other arm. We're just going to worry about one, and it's actually easier to find the veins and arteries in the right arm because remember, the veins and arteries aren't symmetrical, right, for the thoracic region. It's a little bit easier to find them in the right side, so I kind of recommend doing it on the right side. Along with that too, the best way to find and get into the arm, because you're going to have a flap of skin that comes across here since we don't do this cut away. Here you can see that they've actually cut away a bunch of the stuff. We don't have cats that have this stuff cut away with. So what I want you to do is just find the vein, trace the vein into the arm, and once you've traced it all the way through, just cut the tissue that you see going over it. All right, so you're just going to kind of clear the path for this vessel right here. All right, so now let's talk about what we're looking at. We're going to start with the arterial system. So the first thing that we'll need to know is the aortic arch. You also need to know a few parts of the heart, so I'm just going to kind of throw them in there so that we start like with the flow of blood in the heart. You need to know the apex, ventricles, and atrium. You don't need to know left from right for the cat heart. So here you just have apex as the very tip. All of this brown will be our ventricles, and the blue is the atrium. We may not have this nice blue color on ours. Sometimes it's either lighter or darker than the ventricles, but you will see a color change, okay? That is important to note. For convention, if you don't have that, we're going to say the top 1/4 is atrium, bottom 3/4 ventricle, all right? Next we have the aortic arch, and you'll see on the right side that there's a little bump right here. That bump is the aortic arch. And you can also tell that it's the aortic arch because you see these vessels coming off of it like this. Cats have a slightly different setup here. What were the 3 vessels that humans have that break off of the aortic arch? What's the first one? Brachiocephalic. Great. So in the cat, we see brachiocephalic right here is number 5. What's the second one? Left common carotid. Great. Cats don't have that. That's where it changes. So we have our left common carotid actually coming off right here from the brachiocephalic. So both common carotids come off of the brachiocephalic in cats. What was the last one in humans? Subclavian. So we do have the subclavian coming off of the aortic arch still. Right here, where it has our 6, that's going to be the left subclavian, and it'll come around down into here, okay? That's the pathway that'll take. So just remember that in cats, you just have a brachiocephalic and a subclavian. The left common carotid breaks off of the brachiocephalic. So just to trace the rest of the arteries to complete the system, from the brachiocephalic, that first thing to branch off towards the left is the common carotid, which we can see running all the way up along the trachea. Next, we have the right common carotid, which runs up the other side of the trachea, right here. And then this branch that goes off towards the arm, you can see it again over here, is going to be the right subclavian. Now, I'm saying right and left, but remember that you don't need to indicate right or left. Okay, I'm just saying that so it's a little more clear what we're looking at. Okay, so I'm going to focus now on the left subclavian now. So as far as when this changes, you can see it comes up like this and then enters the armpit region right here. The axillary is not very large, and especially when we clear out all of the gunk like this, it's a little bit difficult to tell when it passes underneath the clavicle, right? Because we kind of broke the clavicle. So literally if we pin this for axillary again means armpit, so it's going to be armpit, vessel, just like that. All right, so it's going to be pinned right by the armpit if we're asking for axillary. If it's actually in the arm, that's going to be brachial. Now, no, we're not going to pin it like right here, where depending on like how you're drawing that line, it's kind of a questionable mark. It's either going to be brachial and very much so in the arm, or axial and right by the armpit. Okay, we're going to make that as clear as we can. Okay, I've covered all of the top arteries for the cat. Now we're going to look at the view for the veins. We're going to be looking at the same view, but since the brachiocephalic branches off of the left side of the heart, we've been looking at the left side of the cat. Now we're going to flip over and just see this from the opposite view where we see more of the venous side of things. So that's going to be our cranial nerves. So just flip the view around so we can see the veins a little bit nicer now. So again, we're going to trace our way from the heart away. That's definitely the best way to do this. Start at the heart and then clear the path as you leave the heart, okay? That's important because there are a lot of small vessels that are negligible that we don't really need to worry about. And if you're tracing them back, you can run into problems and you can kind of clear things backwards. So start with the big ones, work your way out. Much easier that way. So this big one that we can see on top will be the superior vena cava. If you move the heart, the apex of the heart to the side, you'll see that there's this blue inferior vena cava that runs down through the diaphragm. This is where I want you to identify the inferior vena cava. All right? I want you to look at it and view it before it actually goes through the diaphragm. This is the best place to do it. Now, following our superior vena cava, we see that first split. That first split is into the brachiocephalics. Now, there are two brachiocephalics in cats. Humans, like I said, it's kind of questionable. You always have a left one, but some people do and some people do not have a right brachiocephalic. It just kind of depends on how you developed. There's really no benefit or curse to having that. So here we have our two brachiocephalics that in cats they always have. So it's brachiocephalic just until here where we see it split again. Then it'll split into the jugular and the subclavian. So you can see the jugular running all the way up here. We're specifically going to worry about and identify it in the neck region. So remember when we were talking about muscles, I said that you identify the sternocleidomastoid because it's on either side of the vessel running through the neck. That vessel is the jugular, and that's what we're going to be worrying about there. So identify the jugular here, even though you can see it's split down here. Now as for this one that travels into the arm, again it's going to be subclavian for its first little bit, and then axillary right in the armpit region, and then brachial once it's actually into the arm. Now if you look next to that, you can see that there's this red vessel running near it. That's the artery. So since I only want you to worry about the right arm, you can just follow the artery going just parallel to it like that, right? So you'll be able to see the axillary and brachial on that artery if you just do one arm. Okay, there's no need to do both. And again, follow the artery into the arm and cut the tissue away from it by looking here and following it through the arm. Okay. Okay, and that's it for the thoracic portion of the veins. Any questions for me?